Caregiving can sometimes feel like an impossible struggle. Caregivers may be torn between taking care of loved ones and trying to maintain balance in life. The good news is that it doesn't have to be that way. The Caring Generation with host Pamela D Wilson is here to focus on the conversation of caring. You're not alone. In fact, you're in exactly the right place to share stories and learn tips and resources to help you and your loved ones. So now, please welcome the host of The Caring Generation, Pamela D Wilson.
This is Pamela D Wilson, caregiving expert, speaker, consultant, and guardian of the Caring Generation. The Caring Generation focuses on the conversation of caring, giving us permission to talk about aging, the challenges of caregiving, and everything in between. It's no surprise that needing care or becoming a caregiver changes everything. The Caring Generation is here to guide you along the journey to let you know that you're not alone. You're in exactly the right place to share stories and learn about caregiving programs and resources to help you and your loved ones plan for what's ahead. Invite your parents, spouses, family, friends, colleagues, coworkers, everybody you know to listen to the show. If you have a question or an idea for a future program, share your idea with me by commenting on social media posts on Facebook, Instagram, Twitter, YouTube, and LinkedIn. You can also go to my website, PamelaDWilson.com, click on the Contact Me button, and complete the online caregiver survey. Today we're answering the question, how to manage care for a sick family member. If you're new to caregiving, you will quickly learn that being a caregiver can have a long learning curve of ups and downs, wrong turns, detours, and frustrations. I'll share why caring for a sick family member can be challenging if you seek help from the healthcare system and lack experience. If you've been managing care for a sick family member for a while and are still struggling, I'll share a few suggestions that might be helpful for you in either situation, new or experienced. My website, PamelaDWilson.com, has an open course webinar program called Support Caring for Elderly Parents with extensive detailed information about managing care for sick family members, taken from my 20 years of providing direct one-to-one care management for clients and working with family caregivers. The program is all online. It's all in video format. It can shave months, if not years, off the learning curve for caregivers. Care for a sick family member usually arises unexpectedly. One day, the family member's doing great. The next day, they're in the hospital or find themselves at the doctor's office. If you have little experience working with the healthcare system, this is an example of how early doctor appointments go. Mom or dad go to the doctor. The doctor makes a diagnosis and typically will write a prescription. In some cases, maybe tests are ordered. Now, mom or dad may not like or trust the doctor if going to the doctor is new to them and they haven't really been proactive about their health. Or maybe mom or dad has financial constraints, money worries. The doctor says to your parents, go and get these tests and come back and see me. Your parents may not really understand the need for the tests, so they're not sure whether they're going to follow up or not. Or your mom or dad at this appointment may be thinking, doctor, you have no idea what my life is like. You're telling me to get a medical test that will cost me money and then come back and see you, which will cost me more money. Money doesn't grow on trees. I can't imagine what today's visit is going to cost me. Your parents are so worried about money at this appointment that mom or dad really don't listen to the doctor or what he or she says about the seriousness or the effects of the health condition. But to be polite, mom and dad nod their heads, appear to be agreeing with what the doctor's telling them to do because they don't want to be rude or say that money is a problem. So they leave the appointment. They take that medical test and the prescription information with them. Mom puts it in her purse, and that's where it stays. Nothing happens. This, caregivers, is where the problem begins if you don't become involved. Now, it's true. Your aging parents have decision-making rights. They have the right to do what they want, live their life how they want, listen or ignore doctors, refuse treatment, and so on. We all have these rights. But the problem is, aging parents don't often think about the consequences to their children who are their caregivers, about what happens when they become sicker and need more help. Who do they think is going to show up? Well, that is you. Even though your parents have never asked you if you'll help them. From my experience working with thousands of older adults, all of these parents assume that their children will help, but they never ask them. These assumptions and expectations make caring for a sick family member challenging. It's not as if most children don't want to help. Many do. But as with everything, there are expectations attached to this assistance. Children expect parents to follow through with doctor recommendations, prescriptions, treatments. This always doesn't happen. You may have no idea that your parents are struggling financially or in other ways unless they tell you. Most parents don't want their children meddling in their personal financial affairs. It's not until parents have no option but to tell you. Know that my parents were the same way. And when they tell you, you may understand, or you may be in shock if they've been hiding information from you. One of the biggest caregiver frustrations about caring for a sick family member is the difference between individual goals. As the caregiver, you want to be able to go on with your life plans that you have stopped or temporarily put on hold because of the time you're spending caring for sick family members. Your career, maybe it's on hold. College, it was a priority, but you can't keep up. So you're giving up taking classes. Marriage, that is now off the table. Your girlfriend or boyfriend wants to marry you, not spend their lives caring for your parents. Spending time with the friends, that is in the past. You don't have any free time. All the while, your parents may be enjoying all the attention they're getting from you. They want more and more of your free time. The doctor, on the other hand, might be frustrated with your parents because they have no interest in changing their habits or following medical recommendations. All your parents want to do is show up at their office and complain and not do anything about it. So, discussions, attempts about care planning hit a brick wall. As a caregiver, you're worrying about what's going to happen when your sick parent's health gets worse. Your elderly parents don't want to discuss planning or preparing for future declines because they don't think it's going to happen. If this is your situation, it's time to dig in your heels and start digging for more information. You want to identify what's wrong with your parents' health, which means you have to attend doctor appointments with them. But before that, ask your parents to share what they think are their health problems. What recommendations have the doctors made? Did your parents follow up? This will give you a basis for next steps. Let's say that your parents don't think anything really serious is going on, but you are watching their physical health and their mental abilities go downhill at a shockingly fast rate. Talking to the doctor is the next logical step. Attend an appointment to learn a little more about your parents' health. If you're not the medical durable power of attorney, have your parents sign permission forms to give consent, which is permission, for the doctor and his or her staff to speak with you. So you're at the appointment, and the doctor seems pretty nice, but You were hoping for proactive recommendations, maybe something like a referral to a specialist for memory loss because you see significant issues. The doctor brushes it off, saying, forgetfulness happens to everyone as they age. But you disagree because you are witnessing your parent become more forgetful over time. Here's a statistic that may help you advocate for a specialist. Over 85% of patients diagnosed with memory loss are diagnosed by a primary care physician, and they never see a doctor who specializes in memory loss, who might offer recommendations and other care. Is this because caregivers don't ask, or primary care physicians don't know about the value of specialists, or they assume that patients wouldn't be interested in learning more? Or is the healthcare system trying to reduce costs? That's a topic for another show. Let's say that besides this memory loss, maybe there's a concern of mom or dad falling because they're unstable on their feet. So as the caregiver, you were hoping for some type of recommendation to help mom or dad regain their strength or learn about a diagnosis that makes what you are seeing make sense. Sometimes all a caregiver or a patient wants is a name to call something. For example, forgetfulness is the result of a diagnosis of dementia or Alzheimer's disease. A parent is a fall risk due to physical weakness that physical therapy might be able to address. Or dad has Parkinson's disease, so his balance won't improve. He will eventually need a walker or a wheelchair. Some degree of certainty about future care for a sick family member by having a diagnosis or a name to call a condition can at least give you some peace of mind, even though receiving that news, that bad news, isn't really what you hoped for or expected. Knowing what you're dealing with can be better than responding to one health crisis after another. You can prepare. Having information allows you to become more educated and proactive in requesting referrals to medical specialists and learning about other services that might be available. After all, it is the doctor's role to refer patients to specialists and health and social care services. The problem is, not all doctors are comfortable bridging this gap to recommend services outside of their system. Physicians might worry about their liability or their reputation if they refer you to a service on a list they don't have experience with and it doesn't quite work out the way they hoped. They may also feel that there's not enough time during a visit to talk about issues like, can your parents pay for a prescription? Or do they understand? Are they willing to follow up with a medical test like blood work? Another concern between providers is a lack of communication and a lack of trust. If a primary care doctor refers to a specialist and that specialist doesn't provide information back to the primary care doctor, then important aspects of care can be missed. For example, let's say one doctor thinks the other doctor is following up on a blood test. But what really happens is both doctors are missing follow-ups because they think the other one's taking care of it. Who suffers? The patient suffers. If tests indicate that timely treatment is needed, action should be taken, and neither doctor talks to the patient about this. For all of these reasons, managing care for a sick family member takes time, dedication, and impeccable follow-up by the caregiver. You can't miss any details. Problems faced by family caregivers when working with the healthcare system include difficulty finding providers due to referral issues, due to insurance issues, or a practice decision no longer accepting Medicare or another insurance program. If a change in doctor is necessary, it can take months to be accepted for a new patient appointment with another doctor. Being temporarily without a physician can be challenging if a parent has ongoing needs for prescriptions or treatment is already underway. There could also be a lot of other complications that relate to social needs in addition to medical conditions. One of these social needs is transportation to doctor appointments. Adult children can't always take off work when parents are scheduled for multiple doctor appointments. They worry about losing their jobs. For other parents, affordable housing and food needs might exist. So I want to discuss the importance of sharing these more personal and sensitive issues with doctors and healthcare providers so that if additional programs are available, you can learn about them. Because depending on where you live and the healthcare system you use, there may be support for these types of social concerns that you don't know about. And this can be a huge help in managing care for a sick family member. So bear with me because I know this is complicated, but it's going to make sense. I promise. Hang in there with me. I'm going to start by giving background information that's going to sound a little technical because it is about the healthcare system and what they're doing. And I know this information can feel overwhelming, especially when you hear it in the news and all these politicians are arguing for this and against that. Half the time, honestly, they don't know what they're arguing for, I'll tell you that. But for caregivers, this information is really important. It can make a huge difference for you, spouses, aging parents, all the people you love. So, take a deep breath, get something to write on so that you can take a few notes and listen to music while we take a short break. Caregiving doesn't have to be a do-it-yourself job. My website, PamelaDWilson.com, offers help, support, and education for caregivers and aging adults by way of online courses, articles, and more. This is Pamela D. Wilson, caregiving expert and advocate on the caring generation. Stay with me. I'll be right back. This is Pamela D. Wilson, caregiver, expert, advocate, and author on the caring generation. Check out my website, PamelaDWilson.com, where you'll find my online caregiver course, book, The Caregiving Trap, my caregiver blog, this podcast, articles in my caregiver library, and links to my online caregiver group on Facebook called The Caregiving Trap. There's something for everyone on my website, PamelaDWilson.com. So let's return to talk about how caregivers, even those who have been in this role for a long time, might be able to find additional help and support in the community that links to care for you, an elderly parent, or another family member. A CMS study, CMS means the Centers for Medicare and Medicaid. It's a study, 5-year study, launched in 2017. Called the Accountable Health Communities Model. I will place a link in the show transcript if you want to read about this. This study began looking at ways to address what the healthcare system calls health-related social needs. Write that term down, health-related social needs. So why should they do this, you might be asking? Their goal, CMS's goal, was to improve health conditions, reduce unnecessary costs like repeated trips to the hospital, and address health disparities. So, what on earth is a health disparity? A disparity is a difference. So, health disparities are differences between people that relate to health. They can also relate to social needs. So, these differences might be difficulty paying for housing, electricity, food, transportation, or medical care, because people who have jobs make different amounts of money. They're employed differently, right? Most people experiencing these challenges, they just do at some point in life, unless they come from an extremely wealthy family where children are born into money and a very comfortable situation. This is rare for most of us, but If you're listening and that's your situation, keep listening so that you can understand what most people experience and why significant differences in health exist. This information may lead you to get involved with your local community, to volunteer, or donate money to make a difference. Other examples of health disparities. The environment. Some people live and die in the town or city where they're born. Others live in rural areas without close access to health care. The nearest hospital or health clinic could be 20 or 30 miles away, and it's hard to get there. Other people may be born and live in communities struggling with poverty or crime. Some people live in unsafe communities, making that simple act of going out your front door a huge concern. Another explanation of health disparities created by Margaret Whitehead from the United Kingdom says that these are health differences that are avoidable, unnecessary, and discriminatory. I'll place a link to an article about health disparities in the show transcript that you can read by Paula Braveman. This CMS study is gaining traction in 2023 because the work done by accountable care organizations, Medicaid managed care, Medicaid health homes, and home and community-based services is showing positive results. When I say traction, what I mean is progress. The Centers for Medicare and Medicaid, CMS, have announced what are called rules for hospital systems, health insurance companies, and other organizations that make it necessary for them to put programs in place to address social determinants of health, that's another term to write down, and health-related social needs. So why does any of this CMS political rules, regulations matter to you if you care for sick family members? It's because identifying these concerns with doctors and community-based organizations mean that now, and this depends on where you live, family caregivers can get support for themselves and services to help aging parents and other loved ones with health issues. Here's the history on this 5-year program. 28 organizations in 328 counties, 21 states, 7 of the 10 largest cities and rural areas participated in the program. So they had good participation. And they used a screening tool that I'm going to share some questions about, but I will also put a link in the transcript so you can read these. Some of you may find answering these questions uncomfortable if you have to share this information with a doctor or somebody that you're not sure you really trust. I can also tell you, though, that the research confirmed that healthcare and social care workers also felt uncomfortable asking patients and consumers these questions because they're very personal. But I can tell you, people who were willing to answer these questions and who were in a community organization that participated in this test program, most of the time, received recommendations for support to address their concerns. So I'm going to take you through the first 7 questions. There were, I think, 26 in total, but let me give you examples and you can think about, gosh, would I feel uncomfortable answering this question at my doctor's office? Number 1, what is your living situation? Do you have a steady place to live? Are you or the person you care for worried about losing your home because of financial concerns or not being able to take care of the property? Is your housing unstable? Are you temporarily staying with friends, living in your car, in a shelter, or even on the street? Does the place where you live have problems with pests like bugs, ants, mice, mold, no heat, appliances not always working, water leaks, or anything else? Question 3. In the past 12 months, have you worried that you would run out of food before you got more money to buy food? And number 4 relates to this. In the past 12 months, did the food you bought run out and you didn't have more money to buy food? Can you see how worrying about these basic things, these things that support living, can be stressful, especially if you're trying to care for someone else. Number 5, did reliable transportation prevent you from attending medical appointments, getting to work, or getting things you need for daily life? Number 6, in the past 12 months, have you had trouble paying electricity, gas, oil, or water? Did the company that provides these services threaten to turn off your services? Number 7, violence and abuse happen to a lot of people and affect health. How often does anyone, including family and friends, threaten you, hurt your feelings, talk down, insult, scream, or yell at you? Are you afraid to go out your front door and walk in your neighborhood? This health screening tool goes on, like I mentioned, for a total of 26 questions, asking more about difficulty paying bills, finding or keeping a job, having somebody to help you out when you need help, feeling lonely or isolated, using substances to cope with stress, feeling depressed or helpless, or having any type of disability. Family caregivers taking care of loved ones experience one or more of these items in this CMS health-related social needs screening tool. Now, if this is you, you might be surprised or embarrassed to answer these questions if a doctor or social worker asked these and didn't really explain why they wanted to know. The goal of asking these questions for organizations in that 5-year study, as I mentioned, was to connect people in need with health, care, and community resources that can help. So let's talk about why it might be difficult to participate in this type of program. The first is obviously being part of a healthcare system offering the program. If you're not, this type of assistance may not exist where you live. But if you're fortunate to be in that situation, the next gap is trust. Do caregivers and sick family members trust the doctor or the healthcare worker enough to participate in the survey and honestly answer all of those questions? I imagine it might feel pretty vulnerable to say, no, I don't have enough money to buy food, or my job is in jeopardy, or yeah, I use a lot of drugs because it's the only way I can deal with the stress of caregiving. Yep, I feel lonely, depressed, and isolated. I don't know any caregiver, or even a person who takes care of themselves, right? Who doesn't want to appear capable and competent and not really need any help. But the reality is many people can benefit from health and social support to put you in a better position to help yourself and help sick family members and to take care of your family and your kids. And many family caregivers, if they knew programs like this existed, I think would be at least curious to learn a little more. So gap number 3 in doing this is the idea of giving consent or permission. Consent means that you agree to have your personal information and maybe even including your health information and the health information of the person that you care for, shared with other people that you don't know who have available services and can help. So this means that in addition to your doctor or the community organization where you get health care, people from other companies and other organizations who you don't know have permission to contact you. Now, you'll likely have to sign some kind of paper or form to give permission or do this through an online website or portal. But know that if you are uncomfortable doing this, ask under what circumstances you can revoke consent, meaning change your decision to give permission for all of this information to exchange. And here's a reason why you might want to do that. Let's say somebody from an organization calls you and they don't follow through, or they're rude, or just something goes bad. And you don't want to deal with this person anymore. So you're thinking, wow, I want to remove access. Well, in most cases, consent or permission can be revoked or canceled. So you do have a bit of control over these programs and who can contact you and who can share your information. The goal of these programs is to bridge that gap between medical and community care and computer programs that don't speak to each other, which is where this permission comes in. The healthcare organization where you or an aging parent or spouse or loved one receives care might have some of these programs already, but they may not be promoting them. So if you are managing care for a sick family member, start asking all of the health and all of the social care agencies that you come in contact with if they have programs that address, and again, write these words down, use this terminology so they know what you're talking about and they know that you know what you need. Health-related social needs, social determinants of health programs. So in addition to these organizations that were in this study, there are other organizations all over the United States who are starting to pay more attention to these issues, which is important because as a caregiver, you know firsthand that managing care for a sick family member honestly can be a nightmare. It extends far beyond only paying attention to health or going to see the doctor. All the stress you experience affects you physically and mentally, and it will eventually affect your health if you keep wanting to do all of this alone. While many caregivers feel they are alone, there's a lot of hope, help, and support to be found if you start seeking it out. Now, if you're hesitant, if you're too proud to ask healthcare or community organizations for support, or you like, oh, I don't have time, Pamela, you're crazy, when am I going to find time to do this? Well, think about the benefits in knowing how these programs could make your life a lot easier, less stressful. So in the meantime, while you're thinking about seeking community support, visit my website, PamelaDWilson.com. Check out my Support Caring for Elderly Parents online open webinar course. Check out articles in my blog. Listen to these podcasts. There are over 150 episodes, and there's a lot of other resources on my website. I thank you all for continuing to pose questions for this podcast and all the videos I share on my YouTube channel. If you haven't been there, check it out. There's a lot of extra help and support there. If you're looking for answers to caregiving and aging questions, again, go to my website, PamelaDWilson.com. So much hope, help, and support there. This is Pamela D. Wilson, family caregiving expert on the caring generation. I look forward to being with you again soon. God bless you all. Sending love and light to everyone. Sleep well tonight. Have a fabulous day tomorrow. And enjoy each day until we are here together again.
Tune in each week for The Caring Generation with host Pamela D. Wilson. Come join the conversation and see how Pamela can provide solutions and peace of mind for everyone. Here on Pamela D. Wilson's The Caring Generation.